Still on health matters amid growing concerns over declining investment in sexual and reproductive health in Nigeria, stakeholders at a national policy dialogue have renewed calls for increased domestic funding, political will, and stronger public engagement to close access gaps for adolescents and women across the country. The dialogue theme, improving adolescent access to quality sexual and reproductive health services, was hosted by Nigeria Health Watch, bringing together policymakers, youth advocates, healthcare professionals, state officials, and development partners to chart a path toward on adolescent reproductive health rights in Nigeria. Our correspondent has more on the story.
According to data from the 2018 Nigerian Demographic and Health Survey, over 19% of teenage girls ages 15 to 19 have begun childbearing. The modern contraceptive prevalence rate among married women stands at just 12%, with higher unmet need among adolescents and unmarried sexually active youth. Access to youth-friendly services remained hampered by stigma, limited funding, lack of adolescent-focused health infrastructure, and lower levels of sexual education. While efforts to expand access have largely been donor-driven, sustainability challenges remain as international funding contracts. This policy dialogue is part of ongoing advocacy to reposition adolescent sexual and reproductive health and rights as a core national priority. The managing director of Nigerian Health Watch, Viviani Ihekweazu, said that the time for rhetoric is over and now is the time to act.
What I would say is, yes, we do face significant increased challenges due to those funding cuts, but also this is a moment for our state governments and also for our country to take greater responsibility for funding sexual and reproductive health rights and services. We know that often political will plays a huge role. State governors have their own priorities, but I think what ordinary Nigerians need to remember is you can have the most beautiful road in your state, the most beautiful flyovers, but if you go to your health facilities and you do not even have the basic commodities, just remember that if you're ill, you cannot use those beautiful roads. So as much as politicians prioritize and our government prioritize a lot of infrastructure, which absolutely we need as a country to support economic growth, we must not leave behind the fact that we must also prioritize education and health, because these two things are critical for building the human capital that will enable our economy, for our country to grow, and for people to thrive in this country.
Stakeholders at the event emphasized the importance of equitable access and youth-centered health systems.
And having realized that the Ministry of Health is always working together with the states to ensure synergy, provide technical support, for them to understand these policies, the guidelines, and what to do, and we always work together with them in developing their costed implementation plans, all that.
The consensus was clear that bold reforms, domestic financing, strengthening primary health care, and youth-led advocacy must drive the way forward.
2030 is 5 years away, and there's a lot that can happen between now and 5 years. So we're not going to write that off. We're in the right trajectory, and hopefully by 2030, hopefully we will be near it if we're not reaching it.
Because education empowers, education saves lives. Therefore, so that's why we are sensitizing them at federal and state level, down the local government, with the support with the other stakeholders.
The event also served as a platform for young people to share ideas about their experiences.
We need supportive supervision, we need value clarification, mindset shift, away from seeing a client as your daughter. She's not.
And we need to improve our data systems and the use of evidence. And I think I'll just wrap up with this, because that's essentially what Nigeria Health Watch seeks to achieve with events like this, to amplify the evidence, like Adachi said, but most importantly, use this to drive advocacy and effective policy implementation.
This dialogue comes at a critical time, following reports of a 97% drop in family planning allocations in the past year, raising renewed concerns about Nigerians' commitments to sexual and reproductive health equity.